My name is Maria Chu, and today we are going to be discussing the bubonic plague, also known as the Black Death or the Black Plague. We're going to be looking into our past to see if we can find any significant features to help us resolve the current epidemic happening right now, COVID 19. What was the Black Death? The Black Death was a disease that spread in the later medieval ages around the time 1347 to 1352. It was severe and wiped out one third of the European population. Back then, you were confirmed a ticket to death if you caught it. The Black Death was mainly caused by fleas on rats and rodents. The Black Plague originated from Asia and arrived at Europe from traders on the Silk Road. It was brought in by boats and was sailed into the European docks. Symptoms of the Black Plague are fever, weakness, abdominal pain, chills, and shocks. These are just a few common symptoms, but there are way more symptoms for the Black Plague. The effects of the Black Death were very dramatic and usually led to death from high temperatures and other symptoms. Blackness of the fingers were common. How the Black Plague affected society. The Black Plague took out approximately 25 million people, which was one third of the population. Many of the deaths were peasants and serfs, which caused the manor system to fail. Without the peasants and serfs to work, the manor could not profit. Any peasants or serfs that could work demanded for higher wages, and they often fled to growing cities when they could. In addition to the manors being affected, the churches were affected as well. The people's prayers were not answered and therefore were losing hope. The priests stopped their service, which made it worse. Like I said, in most places, the manor system fell apart completely. There were not enough peasants left to work the fields. Peasants and serfs who survived the plague found their skills in high demand. They were able to demand high wages for their labor. Once they made enough money, they fled the manors completely and moved to the growing cities. The effects of the plague. Town population fell. Trade declined while prices rose. As peasants were revolting throughout Europe for higher demand, nobles were resisting these demands, but later gave in. Jews were blamed for bringing on the plague all over Europe. Jews were driven out of their own home, beaten, and massacred. The church lost some power when its prayers failed to stop the spread of the plague, and many priests refused to perform their duties. Other interesting facts are when the Jews were being blamed for the plague, they were also equally affected by the disease. However, some Jews admitted that they poisoned the water source after being tortured. The Jews were given a choice to either convert to Christianity or burn at the stake. People believed that bathing was a sign of vanity and that it could possibly open pores for bad air. So they did not bathe. People also thought to prevent the Black Death, they should not eat fruits, drink good wine, or think happy thoughts. In these medieval ages, it was a pre antibiotic era. They did not understand microbiology and how infections are acquired or transmitted. So the outcome was completely devastating. What is COVID 19? Coronavirus are a large family of viruses that cause illness ranging from the common cold to more severe diseases. What is spreading currently right now in our world is called COVID 19. Coronavirus gets their name from their appearance. Their spiky appearance resembles a crown. Symptoms of the coronavirus can range from fever, shortness of breath, and coughing. Some patients may have aches and pain, runny noses, sore throats, or even diarrhea. Like other viruses, the severity of symptoms can vary between individuals from being mild and unnoticed to death in others. Older people and those who have underlying medical problems like heart problems or diarrhea or diabetes are more likely to develop serious illness. COVID 19 spread from person to person through small droplets that exit the nose or mouth of a person with COVID 19. That is why it is important to stay away from these people who are sick. The virus can also spread when the droplets land on objects and surface around the affected individuals as they cough or exhale. Other people that catch COVID 19 by touching these objects or surfaces then touch their eyes, nose, or mouth. While both the common cold and COVID 19 may be transmitted the similar way, there is also a possibility that COVID 19 is an airborne virus, meaning that tiny droplets remaining in the air could cause disease in others even after the ill person is no longer near. The incubation period is a time between a person catching the virus and when they actually begin to show symptoms of the disease. Most estimated of the incubation period for COVID 19 range from 1 to 14 days, most commonly 5 days. Is COVID 19 our civilization of the Black Plague? When you look at the events of the past, you see that current coronavirus hardly compares to the size and scale of the earlier pandemic. The human tendency to avoid or ignore the sick has not changed, even during the Black Plague, with people limited knowledge of medicine. Europeans witnessing the plague understood the importance of avoiding those tainted by the disease. Thankfully, we are not descended into the level of terror with the threatening spread of the coronavirus. The coronavirus is a new disease caused by a novel coronavirus that has not been previously seen in humans. This new virus and disease were unknown before the outbreak began in Wuhan, China in December 2019. The coronavirus pandemic is overwhelming to comprehend. There are now hundreds and thousands of confirmed cases. Tens of thousands have died. Nations are on lockdown as the disease continues to spread. The planet is in crisis. Public health response. The coronavirus pandemic owes one of its major features to the Black Plague outbreak, quarantine. In response to ongoing Bubonic Plague outbreaks in Europe, it led to new public health measures like compulsory burial and limited places to be around or have crowded individuals. Likewise, millions of people across the globe are currently in self isolation in efforts to curb the spread of the coronavirus. In addition, we have responded to the coronavirus with proactive efficiencies, putting safeguards in place to eliminate the disease as much as possible. We are on high alert, ready to combat any further spreading that occurs within the US. Is this scary? Yes, but it is an understandable reaction, given the knowledge that the epidemic may cause indescribable harm. Currently, there are many debates within our own communities saying that our government is not handling any of these well, and it is understandable, especially with everyone being worried about whether or not they will be able to survive this pandemic. Our government should put aside their differences and look for a solution to help save lives before more deaths are put down on the books. Despite our fear, perspective is key. Looking at the events of the Black Plague helps us understand what has occurred in the past and how humans reacted to those tragedies. Using that perspective, we can decide how we would choose to react to the coronavirus. Although there are significant differences between the pandemic of the Black Plague and COVID-19, there are key takeaways. Surveillance is important. We have also learned that physical distancing and quarantine measures work. It is also important to remember that the pandemic will end and that modern science and medicine could be incredible forces for good. We no longer live in the dark ages. We are better armed today than we have ever been.